what is the difference between a disorder that is egosyntonic versus egodystonic? Well, I'm going to break it down for you so that you understand it and give some examples as well that will help you in clinical practice, as well as potentially on licensing exams. So let's break down kind of what the words are. We have ego, which in psychoanalytic theory is looking at the self, me, that's kind of who I am. And then we're wondering whether the behavior is in sync, like synchronized swimming, or if there's some dissonance. So the root syn in Latin means with or together. So think of it in terms of synchronized, synergy, synonym, synthesis. They all have that common thread of meaning like two things that are similar or together or congruent. And then dys tends to mean bad, ill, or abnormal. So dysfunctional, dysphoria, dysentery, that's a fun one, tardive dyskinesia, which is another good thing to know for the social work licensing exams, those involuntary movements in the lips and mouth and jaw and face that can come as a side effect from antipsychotic medications. So syn is kind of together, in line, dys is having that difference. So something that is egosyntonic is where someone's behaviors or thoughts align with their personal values and goals. They're in harmony, they're consistent with your self-image. And importantly, there tends not to be any guilt or proactive desire to change those thoughts or behavior. It's a come on in, this is fine with me. Whereas egodystonic are behaviors or thoughts that go against your own personal willpower. They're inconsistent with your beliefs, values, they're seen as intrusive, unwelcome guests, and there's often some sort of guilt or desire to change that. And if you see ego alien, that is the same thing. It is a synonym for egodystonic. They're basically the same thing. But an important note here is that it's not necessarily that something syntonic is a good thing and something dystonic is a bad thing. That's not necessarily the case. Rather, it's all about whether you're uncomfortable with those behaviors, thoughts, feelings, symptoms. Is there that woo factor, like this cat here, that you want to change? It feels uncomfortable and you want to address it. So some examples of disorders in the DSM that are traditionally seen as egodystonic. Disclaimer here, I say sometimes, because it can depend on the person and the situation, and there's some nuanced factors here, but I'll just give some general examples. So we've got another what the heck face here to kind of show this is like a dystonic reaction. So with depression, most people want to be happy and to have energy and to feel motivated and to have healthy sleeping and eating and so forth. And so when they feel sad and unmotivated and are not getting pleasure out of the things that they used to enjoy, that is discordant with what I wanted as a person and what my values are. And so that is dystonic. Similarly, with a social anxiety disorder, most clients that I've worked with, don't want their identity to be in dreading their nephew's birthday party or other things like that. They want to have social connections and to be rid of that element of themselves. It's not a positive part of their identity or functioning. And then same thing with post-traumatic stress disorder, obsessive compulsive disorder. PTSD might have intrusive flashbacks, the key word being intrusive. You don't want those flashbacks, and obsessions with OCD are often seen as being unwelcome. Whereas, on the other hand, we have some things that are sometimes egosyntonic, like a lot of personality disorders. If we take narcissistic personality disorder as an example, someone with that diagnosis is not typically characterized by fretting about the impact of their personality and behaviors on others. They usually don't see a problem. They have an inflated self-image, and so behaviors go along with that. And so that's egosyntonic. It's all kind of in line with identity and values. There's not a disconnect there. Some somatic things like anorexia nervosa or body dysmorphia. With anorexia, you have a distorted body image, and so there might be a restriction of food intake in line with the client's distorted body image and goals of being thin. This does not mean any way saying that these disorders are a good thing or shouldn't be addressed, but sometimes a client, with an eating disorder may kind of be in denial about the harm that it's caused, and they don't necessarily want to seek treatment. Again, sometimes, not universally true. With body dysmorphia, there's this kind of identity of a certain, body part is not really a part of my body and shouldn't be a part of me. And so pursuing, say, a surgery or something like that to change it is in line with the ego and the self. And then delusional disorders as well. I had a client, for example, who believed that one of my coworkers was a robot. The client believed that he blinked a lot, and so that meant that he was trying to clean the lenses that were in the cameras in his eyes, and that working with this individual would mean that he was being filmed. And there were some persecutory beliefs about that regarding the CIA and whatnot. And so the client wanted to avoid this colleague of mine. The client wasn't lying in bed at night worrying about how it impacted my colleague that he didn't want to work with him. He made what to him felt like a rational decision to minimize risk. And because there was that strongly held belief, it wasn't seen as being dystonic, it was syntonic. Want to emphasize again that it depends on the person or the situation. So the behavior of lying on the couch all day, if you are sick with flu, so that you can rest and become healthy because you value your health and relaxation, that seems like a perfectly good syntonic behavior. But if you're a marathon runner and you just felt lazy and, were out partying too late the night before and you ended up just hanging out on the couch all day and missed your marathon, there would probably be that would be more described as ego dystonic. There would probably be some guilt or a desire to address that, maybe in a therapeutic setting with behavior change or whatnot. Giving people gifts as the behavior, right? That would be egosyntonic for Oprah or the Tooth Fairy, but not for the Grinch. So let's look at some examples here. So say a client reports a seemingly uncontrollable temptation to regularly gamble with large sums of money. He sees himself as a family man and feels guilty for causing his family to be in debt because of the gambling. He hopes to become a more responsible husband and father by beating, quote, client words, his gambling addiction. The client's behaviors can be described as... So the behaviors are dystonic here because he dislikes his own behaviors. There's shame. It's not in line with his values or goals, not mine, but his perceptions of how he, quote, should be. So the behavior is ego dystonic. There's that kind of feeling associated with it. How about this one? A client observed to be experiencing racing thoughts, grandiose beliefs, and a feeling of invincibility. Mania, anyone? As a result, the client feels that his inherent luck will prevent cars from hitting him if he were to step into traffic. Family members tried to persuade him to seek treatment, but the client doesn't think there's anything wrong with him. So the feelings are ego dystonic, ego alien, ego symbiotic, or ego syntonic. Here's a little cheat sheet, right, of syntonic versus dystonic. This would be syntonic. I just made up ego symbiotic. Don't get confused. That's a red herring. There is no such thing. And ego dystonic and alien are the same. So what other examples might you have seen in practice with clients? I'd love to hear some other de-identified examples of scenarios or disorders that you think might be ego syntonic or dystonic. Thanks for watching and good luck.